Hello everyone. Hello. Yeah. Hello everyone. This is Nandini Day. Good evening all. And we are live on YouTube right now. So I'm going to start our webinar, one day international webinar. So good evening everyone. This is Nandini Day. Welcomes you all in this beautiful summer evening. Independence. Independence is not the right to do as we please. It is the opportunity to do what is right. Let's all be a responsible citizen in this hard time. Happy 74th Independence Day to India. Let's hope this day make us independent once again from the pandemic and let us breathe freely. I welcome you all in this one-day international seminar presented by Professional Institute of Business, Bangladesh. It is easy to kill individuals, but you cannot kill ideas. Great empires crumble while the ideas survive. So let's get together to discuss some great ideas which will survive from one generation to another. Professional Institute of Bangladesh Business presents one-day webinar on mental health issues and suicide prevention. Many of us have been touched by suicide, and loss of loved ones, family members, or friends. It is estimated that around 15% of adult population experience depression at a point throughout their life. Whatever the cause, for some of these people, the emotional pain will become too much that they consider suicide as an option to escape. In fact, 8 million people go through with the suicide every year. For each of those, these are around 25 times more suicide attempts. Suicide doesn't end the chance of life getting worse. It eliminates the possibility of it getting any better. With those words, I would like to welcome respected chief guests, honorable guest of honors, valuable participants in this webinar, that is mental health issues and suicide prevention, to discuss great ideas. Let's all welcome our chief guest, Dr. Khalid Sir, senior clinical psychologist, currently working as a senior faculty of MBA and EMBA program, AUST, Bangladesh. He has 38 years of experience in various fields of psychology. Sir, we are glad for your presence in this webinar. Please bless us with your address note. Over to you, sir.
Okay, thank you, Nandini. Good evening to everyone and honored participants. Indian friends, happy Independence Day. SGT University, Gurgaon, India. She might not be available today as she's preoccupied with some other urgent work. Second, Dr. Sheikh Abdul Bashir, Senior Consultant, Neuropsychiatrist, Founder, Director of Mind Piper. Dr. Arifa Mansuri, Associate Professor, St. Xavier's College, Ahmedabad, Gujarat University. Professor Dr. Chatterjee, Associate Professor, University. Mrs. Ketki Tangais, sorry to maybe, Program Manager, Preventing Suicide. And very special thanks to Program Coordinator. It could only be possible due to your hard work round the clock. I want to share few outlines on subject topic on mental health issues and suicide prevention. Actual facts about suicide ideation. Most people who have suicidal thoughts do not carry them through to their conclusion. Causes of suicidal thoughts can include depression, anxiety, eating disorder such as anorexia, and substance abuse. Less are more likely to have suicidal thoughts. Symptoms. feeling or appearing to feel trapped or hopeless, feeling intolerable emotional pain, having or appearing to have an abnormal preoccupation with violence, dying or death, having mood swings, identity guilt or shame, consuming drugs or more alcohol than usual, engaging in risk behavior such as driving carelessly or taking drugs, getting hold of a gun, medications, or substance that could end their life, experiencing depression, panic attack, impaired concentration. Causes: a family history of mental health issues, a family health of substance abuse, a family history of violence, a family history of suicide, a feeling of hopelessness, a feeling of circulation of loneliness. High risk of suicidal ideation include attachment disorder, anorexia nervosa, bipolar disorder, body dysmorphic disorder, borderline personality disorder, dissociative identity disorder, gender dysphoria or gender identity disorder, major depressive disorder, panic disorder. Suicide prevention. Stay with the how to prevent primary level suicide prevention. Stay with the person until professional help arrives. Remove any weapons, medications, or other potentially harmful objects. Listen to the person without judgment. Following up with them after the crisis has passed, as this appears to reduce the risk of. I don't want to taking too much time, because I know the more resource person, valuable, important person will deliver their thoughts and ideas, share with all of us. Okay, thank you. Thank you, Nandini.
Thank you
Hello.
so much, sir. This is our
You,
honor. Hello.
okay, you can hear my lecture was delivered.
Yes,
It was
sir.
okay.
You are audible.
Okay,
Yes, sir.
okay.
Thank you so much, sir. We are honored for your valuable suggestions and the knowledge you have shared. Now, I would I would like to welcome Dr. Sheikh Abdul Bashir, Senior Consultant Neuropsychiatry, Founder Director of Mind Piper, with 28 years of experience in Home Ministry of Saudi and NHS UK. Over to you, sir.
Thank you, Nandini. Good evening to everyone. And I presume that everybody who are listening to me, they are mental health professionals, or maybe there are some general public. So I should congratulate the Professional Institute of Bangladesh, especially selecting this topic, suicide. Normally, there is a general um, I should say general apprehension that people think, especially I remember our studenthood, that when taking history of the patients, we are afraid of asking them about suicide. We are afraid that maybe we are putting ideas in their mind that after that already the patient was so hopeless and depressed. If I ask them about suicide, they may get into the suicidal mode actually in action, but it is not so. Actually, it has been seen that the more you talk about it, the more you can prevent. In fact, there are people, these people, those who are going through the worst time in their lives, they are so relieved to discuss about this, their fear. And once they start talking, there is a huge scope of saving life. Just 2 minutes of your talk can save an important life. And there are so many statistics about suicide all over the world. We lost huge number of lives. But one important statistics I would like to give here. You see, the young group, that is 15 years to 35 years of age, I should say this particular age group, we say the best age, the young age. Even in this age, the number one cause of death is road traffic accident. And guess the second one, it is suicide. And these suicide deaths, out of these suicide deaths, the research has shown that at least more than 50% of them were suffering from depression. And depression is a preventive disorder, treatable disorder, and we could diagnose early and save lives. The National Institute of Health and especially the Mental Health Division of USA, for the general public, when dealing with person with suicidal ideas, they have a very simple ABCD. Not ABCD, but I tell it ABC. So one is that number one, please ask. I think that if I'm an examiner for students in mental health area, any psychologist or psychiatrist, if a person forget to ask about suicide in the history taking, I will fail him. It is a must that every patient in the mental health OPD should be asked about suicide, and that special how to assess that suicidal intention, that is very, very important. To risk that, to assess that risk that person is undergoing is very, very important. We have to make a tirage. We have to accordingly allot the health resources. Sometimes we may have to detain the patient. Sometimes we have to admit the patient, and then the various types of professional treatment should start. So what are they? Again, I am repeating. Now, number one, I'm just telling anybody who comes across a patient who is either you feel like suspect that he can commit suicide, you feel that he is high risk, or already he must have expressed that he is thinking about suicide. So number one, you ask that do you really planning a suicide? And straight away, no tortuous questions, straightforward. Number two, the moment you know that patient is at risk, as Professor Khalid has told, make him safe. So how to make him safe? Number one, immediately according to the risk, take away all the lethal objects around him. Like as he has told, it is gun. And most common suicide methods, usually it is injection of poison, self-injection of poison, and cutting and etc., or jumping from very heights. So number one, you have to detain the patient. And sometimes all over the world, the law allows sometimes to forcefully detain the patient against their will if already you can prove that there is risk towards his life. And number two, be there with the patient. And as exactly Professor Khalid has told, if the patient is still at risk, don't leave him till the actual professional team arrives or the patient is actually in a care home or a hospital. Number two, ask the patient or give a number or any or everyone, especially in any crisis situation or all over the country, there should be a helpline number, and not only that is very visibly advertised available, but also the patient should be given a very personal number of a caretaker, if possible, anyone responsible from his family, anyone responsible from the law like police or from the hospital or from even a religious leader who is close to the patient. And finally, we also repeatedly has to keep in touch with the patient. So what are they? So number one, I am repeating, it is A, ask the patient, then S, make the patient safe, then it is B, that be with the patient, then C, it is connect with the patient, and C again, tell the patient to connect with the proper authority. Now coming to a psychiatrist point of view, when a suicide risk is there or when a suicide has been already tried. Now a very big number of cases which comes to a psychiatrist, they are called the para-suicide. What is para-suicide? These para-suicide patients, they have already attempted to commit suicide and they failed. Luckily they failed. And these are very high risk group. And usually if I remember my hospital days in Dr. Ram Manohar Lohia Hospital in Delhi, or of course many other hospitals in the future I have worked with. So first of all, the patient, whoever has committed something like this, they are not a case for the psychiatrist first. They are going to the emergency room, the casualty. Suppose they had to first of all cleared by the physicians and the surgical people to be safe. Like if this patient is already, as Strike stated, lack of oxygen, the serious the oxygen supply should be there. If there is any cut, there should be a suture. If there is a drug involved, that should be taken out of the body. The patient should be conscious. Only when the patient is able to really talk properly, then a thorough mental assessment should be done. Now, when it comes to assessment, that is very important. Now, I am talking about just now, as I have told you by the National Institute of Health, the assessment of a patient at risk by a general public. Now, I am talking assessment of a patient at risk by a mental health professional. So, what are they? Now, normally, what happened that it is as I see that the patient is already committed something very dangerous. The patient is already most probably in a huge pain. The patient is, if depends, if the patient is already very mortified, or the patient is repenting that he has committed, or the patient is repenting that he has not been successful. So that sort of situation. So we have to be very, very tactful in asking these patients about the suicidal risk. So what I do in my OPD, usually once I know that the patient is there is a risk of suicide, especially the patient when he appears very hopeless, or especially if there is a history of similar thing in the past. First of all, I ask the patient, do you feel that the this is time that you wanted to be with God? I ask them हिंदी में कि आपको लगता है कि आपको ऊपर वाला उठा ले तो अच्छा है. And from there, if I sometimes the patient say, yeah, it is a fleeting thought, and sometimes they say, no, it is repeatedly coming, I am resisting. And then the next question will be that how often it is coming, how long it is coming. Then the patient, I will ask the patient that if you are repeatedly thinking about it, are you having into planning? So in that planning, you have to see that suppose the planning of the things, number one, the patient start collecting the physical amenities to commit the thing, like collecting a rope, or collecting poisons, or collecting a gun, and so many other things. So that thing. Then also you have to see that suppose I have seen patients, the patient will tell that at one moment I really ran up to the roof, and then I come back. So even that is under the planning. And then after that planning, I will also ask that have you ever tried sometimes in the past? Yes, there are patients who will admit that in the past they had tried and they failed, and that is hidden by from many others, because this is something till few years back it has been a criminal act to commit suicide, and usually there's an FIR registered in the police station. So patients are already afraid, patient wanted to hide the things. And then after this physical assessment, we have to really assess, I should say, in the psychiatric point of view. As Dr. Khalid has already mentioned us, that now we have to assess the risk the patient is into. Already, what are the risk factors? Let me tell you, somebody who has tried to commit suicide and he is saved, that is a parasuicide. In that case, there is a huge chance that 1% of them will commit suicide within the next 1 year. And that is a huge risk, because that is 80 to 100 times more than the risk in the general population. So that is a high risk group, and that particular risk group has to be very closely observed. And also this particular group of patients, they are the highest risk in the first 1 week. So there rise the question that any patient who has committed suicide, tried to commit suicide, and somehow they had been saved, they had been found out, they had been discovered, or they had been deported and they are brought to the hospital. It is better to keep them in the hospital at least more than 1 week, after not only about the coming out of the physical risk it has been put, but also come for the full evaluation. Now in the evaluation, what are the things we have to see? Number one, we have to see that what method the patient was taking. So unfortunately, in modern day life, we are full with poisons inside the house. Like as you see in India, it is commonest suicide method is ingesting the agricultural pesticides. So suppose we know the patient that the patient is suicidal, and they should be very safely under the lock and key. Then other things like also many of the patients, they in fact 90% of the patients who has tried to commit suicide, they had found out to be taken two major methods. One is either taking poison, and other either cutting themselves. So sharp objects and all that. Then one very important issue I have to find out in my patients, that sometimes what happens, the patient is very serious about committing it, but unfortunately the patient knowledge was not much. So patient must have taken a very diluted, let us say, just phenyl, So that may not have killed him, but we have to really assess the patient's faith or patient's belief that I will really commit, because in the next time he may have knowledge to use the correct type of poison and really get into serious issue, like he may lose his life. Then there is some other thing that we have to really see the how the patient was planning. In that planning, there are also things like many patients, if you take a proper history, the patient will tell the patient has already tried to close the accounts, bank accounts. The patient, many of the patients, they try to write a will. Many of these patients, they try to sort of, they try to pay back the loans they have taken and this and that, as if they are preparing for the last wish. And then also we have to also say that suppose somebody who has tried to commit suicide. So also if there is another issue in sometimes in these actions, sometimes there are some patients who really do not want to commit the suicide. They don't want to die, but they want to draw the attention. Especially if you see in a situation of a couple and there is a fight and there is a row, so they will just try to bring the attention. So you have to really see that sometimes when the patient is very serious, the patient will be really making sure that it is really unnoticed that he is trying to do something. But the patient who has a secondary gain, like to get the attention of his spouse or boyfriend or girlfriend, he will try to see that it is visible. So that's why it is not that serious. And then also one very, very important, I always has been emphasized by my professors during history taking, if the patient has a history of committing a very violent act of self-harm or something like this, it should be taken very, very seriously, which I have already told. Then also some after that initial this physical evaluation and all that there is, we have to, as a psychiatrist or as a psychologist, we have to evaluate the mental status of the patient. As Nandini has told in the very beginning, that it is not that patient wants to die. The most probably the patient they wants to come out of that huge pain, and that pain that is outcome of a severe hopelessness, very severe worthlessness, very severe for feeling of helplessness. The patient feels that I am at the end of the tunnel. There is no help available. There is no hope, and that pain. And many of this feeling of the patient, they are of a sometimes very illogical, sometimes not really properly logically evaluated. And suppose in that situation, if the patients can be given hope, you can save the patient. So what we need to do, number one, we have to look into evaluate the patient's attitude. Like sometimes the patient has been saved by the professionals, the hospital. Then we have to see his psychology of, is the patient feel relieved that he's regained his life, or if the patient is still very disappointed at why the hell he is back in this world. Then we have to be serious that patient in the second case, the patient still wants to die. Then this third one, that we have to, of course, in most of the patients, as I have told, as Dr. Khalid has evaluated all the mental disorders. So first of all, our main intention will be if the patient is going through a present mental disorder, or in the past the patient has a history of mental disorder. So if evaluating in the depressive disorder, we have to give the highest attention to the patient's mood. And there is another thing called anhedonia. Luckily, all those were living were enjoying life. We had a knack for living it. We are waiting for that perfect blend of tea and biscuit in the morning, or that particular coffee in the evening, or that chat with the friends, or a great dinner, or just a loving presence of the family. And that is called in French a joie de vivre. But in some patients, that is lost. The patient has lost interest in everything. Sometimes it looks so funny. Some of my patients' relatives has reported to me that this particular lady, she will never miss any Saas Bahu serial. And this lady is missing it. That is a very telltale sign. That is anhedonia. Patient is not interested in anything anymore. Then there is very important, as Dr. Khalid has just pointed out, you have to evaluate about substance abuse associated. There are so many things. Number one, all these substances which acts in the brain, they are toxin for the brain. Already they are taking the brain in a different, totally illogical direction. They lost their judgment. What they are doing, they doesn't know. Number two, already these drugs and all that, what they themselves are poisonous in a particular dose. The patient may have trying to take it as an entertainment, but at some point of time it can go high. So first of all, we have to evaluate if the patient has taken any drug. Another thing, that when, as very repeatedly I will tell, that when a case of suicide attempt or a risky high risk patient of suicide is with you, we have to first of all evaluate the physical things first, because that is the most important, and that can be reversible. The patient, if the patient is feeling breathless after a suicide attempt, the first thing to do is not to evaluate mentally, but give him oxygen. If the patient has a cut and bleeding, our most important action is to stop the bleeding. Anyway, so we have to also evaluate the drug type of taken, and there are, thank God, there are lab tests where we can find out what types of drugs the patient is taking, and there the toxicologist or the medicine specialist and involved to sort of oppose the action of the drug. Sometimes we are lucky if we can make the patient vomit, and sometimes we are lucky if we can put on some antidote, some different chemical to cut off the action of the particular drug. Then also in most of these patients who are committing suicide, it is nothing but aggression turns toward themselves. So suppose such aggressive patients, we also have to evaluate their risk to others. Sometimes a patient who has planned to kill himself by putting on the gas in the house, maybe he is putting the whole house at risk. That we have to evaluate. And then in the history, as we see that, like any mental health disorder, if we take suicide as a mental health disorder, so it is a biopsychosocial situation. So I am just now, as I have, it is a mixed thing and everything has to be evaluated. Now coming to the social or personal situation, we have to evaluate the immediate trigger, like whether it is a fight with the spouse, whether it is an immediate job loss, or whether it is a imminent bank loan to pay, as it happens with our farmers, those who are committing suicide in hordes because they have taken loan from the bank and they are not able to return it back. Then we have to also see that what is his present social situation. Suppose a patient, if he is already alone, and it is a high risk group, those who are lonely, single. So don't take it as a light matter. Being single is a high risk. Then somebody who is married but widowed, very sad, already bereaved. And the third one, married and divorced. That is another side type of bereavement. So this huge group we have to inquire about. Then something like immediate fight, or there is something like some social situation where the patient is highly humiliated. There is huge number of suicides. Every time it gets escalated when there is an exam result is out. The child thinks that I'm so bad situation. How can I show my face? And then of course there are celebrity suicides and there are various research going on. But I am 100% sure that properly scientifically evaluated, not only will find out that there is a psychological disorder in the person, but also there is a social situation which is the triggering or precipitating factor. And there is, of course, many cases where I see that we have to evaluate the physical illness. And again, in psychiatry, one very particular duty of the psychiatrist comes where the psychiatrist should evaluate if the patient is on any psychiatric drugs, if the drug was really taken properly. Like somebody on depression and the person is not taking the medicine, so patient is not taking, that is putting in more risk. And of course, I would like to also clarify here a very important area, that there is a recently there is a lot of interest, and that patients given antidepressant and there is a risk of suicide increasing. So my explanation is that when the patient is very depressed, not only patient is mentally down, but also patient is physically down. So till the patient started an antidepressant, the patient's mental health has not improved, but his physical health is improved. Patient can have enough physical energy to collect the methods to commit the suicide. So patient under initial treatment of antidepressant should be highly under observation. So anyway, then there is one more issue, like patients in even associated any physical condition has to be evaluated. I have seen patients, and it's very comorbid. Even depression is associated with many very severe chronic physical disorders, and that's chronic physical disorders. There are patients with severe pain, and this severe pain has to be taken care of, and they can send to depression and commit suicide. Coming, I will not go much further into the evaluation, because if I want to hammer anything into the mind of the listeners today, I should say they has to keep their antenna very alert. They should keep their eye open and ears open, and like smaller sign, they should be very much like a detective, and it is better to be over suspicious than lose something. And of course, that time I have also unfortunately seen that patients under detention inside the psychiatric hospital, they have also committed suicide. So there lies the evaluation every day, even twice in a day, of the patient. And of course, today it is lucky that we have this CCTV monitoring. The patient, in spite of that, there is a issue of privacy, but such high risk patient has to be put under very serious observation and monitoring. Now coming to the treatments, I will not tell much about the treatment here, because as a patient who has tried to commit suicide, taken his own life, the first thing is that it is a medical emergency or surgical emergency. So first of all, let us come out of that. Number two, let me tell you, as I have told you, if we take a number of risk the highest risk in suicide is among the patients with depression. Then the highest risk is patients with anorexia nervosa. Then the highest risk is with patients with psychosis. That includes schizophrenia, delusional disorder, acute psychosis, or schizoaffective disorder, or mania, or anything. Then the highest risk is the neurotic disorders like obsessive compulsive disorder and the anxiety disorders. And there are of course various other psychiatric disorders. And in compared to other general physical conditions, the psychiatric disorders have the highest risk of suicide. So with this, I will conclude my talk, and I welcome as many as questions possible. Please write them, and at the end of our session, I will try to answer them. And finally, just one big line that what I would like to add to the people here, that please admit, please, we are lucky that today I am into this psychiatric field for the last 28 years, and what I see, there is tremendous technological improvement in terms of biological treatment. And I will also emphasize there are beautiful treatments to treat the depressions. Presented depressive treatment, they do not have much side effects. They are very effective. They can bring the patient back within a week. And of course, I will always emphasize there is a very good treatment in very serious suicidal depressive patients called electroconvulsive therapy, ECT. And some very new treatments are coming called ketamine, which is used in anesthesia. They can be used. Thank you. Next to the next speaker, please.
Thank you so much, sir. Thank you so much. Whenever you feel worthless, just place your hand over your heart and ask yourself, can you feel it? It's called the purpose. You are alive for a purpose. Thank you so much, sir, for giving us a wide knowledge about etiology of suicide and sharing your medical experience with us. I hope it helped us a lot. Next, I would like to welcome Dr. Arifa J. Mansoori, Associate Professor, St. Xavier College, Ahmedabad, MPhil and PhD guide in Gujarat University, and around 24 years of teaching experience. Arifa ma'am, we welcome you in this webinar. Arifa ma'am? Arifa ma'am?
Yes. Yes.
Yeah, you are audible right now. Over to you, ma'am.
Yes. Respected Khalid sir, guest of honors, our coordinator Nandini, and the participants. A very good evening to all of you. Let me take the privilege of being thankful to Khalid sir and the team, the Business Institute of Bangladesh, for giving me an opportunity to express my views regarding the mental health challenges that we are facing today, and even what is to be done as preventive steps for suicide. My topic for today is what are the challenges that are being faced as a psychologist, and even what are the steps or the measures that we can take at the individual level. Khalid sir has given us a brief idea about the causes of suicide, and Basir sir has given us a medical perspective. Since I'm working with the students, and for that reason, teaching psychology is again helpful to us at each and every step of our life. So I selected the topic as how to cope up with the suicidal ideation. The ongoing challenge of COVID-19, which has come as a great challenge and a great mental health challenge, which each and every country is facing today. It is a global challenge. It has become, again, a worldwide issue for all the health professionals, even for the patients who had been found to be positive, and even for the patient himself. For the general public, again, it is very important. People have been so much confused. The general public had been much confused because they are being bombarded with so many symptoms. Almost all the channels, all the medias have been talking about COVID-19. And this has given rise to much confusion in the minds of general public. COVID-19 pandemic has again affected our social integrity, and it has taken different forms, namely isolation, loneliness, contact restrictions, economic shutdown. This has affected our psychosocial environment as to remaining isolated, self-quarantine, again, or maintaining social distances at home or even going at the marketplaces has affected our mental health. So far as Indian culture is being concerned, ours is a community-based society, and maintaining social distance has again become a mental health issue for everybody. Now, this pandemic has not been challenged for the health professionals. It is again affected, or it has affected almost all the people, all the developmental stages, maybe children, again youth, adolescents, adults, and even the elderly people. This stressful event has a very threatening effect, which once we thought of as death anxiety, but now this is pandemic anxiety, where there is an increase in the suicidal thoughts, self-harm, and again, number of cases that have attempted suicide. And as per what Basir sir said as parasuicide, that is suicidal thoughts and attempting for suicide. How it has affected our health, our mental health. Staying at home is really a punishment for each and everybody. Increase in isolation and loneliness. Even at home, people are mostly restricting touching. So this has given rise, or this has even affected our mental health. Lack of daily tasks. Somewhere even I think that I have become lazy maintaining my daily tasks, unless and until the government is not imposing the online lectures. Very important is knowing that one is at a risk. As I told you earlier, that we are being bombarded with so much of knowledge and the symptoms regarding this corona. Even I have been a little bit confused about whether I am positive. A little sneezing or breathlessness leads me to think that, oh, really, is it? The most important mental health challenges, the self-harm and suicidal ideation. There have been the cases as self-harm and suicidal cases or suicidal ideation cases, which has a long history. But what the challenge is that there is increase in self-harm and suicidal ideation. That is again a big challenge for all of us to deal with. Mental health conditions and the issues has risen. There is spike in self-harm, suicide, and suicidal ideation during this COVID pandemic. The suicidal ideation has increased among the youth. That is again a great challenge for mental health professionals. And this suicidal ideation among the youth is due to fear of insecurity, fear of losing job, again, fear of getting job in future, how far this lockdown will continue, what would be my graduation degree, what will I do, how the exams would be conducted. This has always remained a question during the pandemic for my students. And every time I get at least 10 calls within a day and 20 messages, ma'am, what next? When are the exams? Are exams conducted or not? So they are still having such thoughts as self-harm, suicidal thoughts, which we call in psychology as suicidal ideation. And there is again increase in aggression due to frustration. All this has given rise to anxiety and depression. Anxiety and depression are not at all new. But what we are concerned over here is the level of anxiety, the number of cases regarding anxiety, this neurotic disorders and depression, there is a rise in that. So rise in the number of cases, plus we are talking about as the level of anxiety and the level of depression has again increased. The frequency has increased. Now this is again a mental health challenge for all of us. Because of all this, it has given rise to adjustment syndrome. Just let me give you a brief idea in one line about what is self-harm. Self-harm is hurting one's own self while feeling distressed or disappointed. Suicidal ideations are the thoughts to kill one's own self when the pain is unbearable. An adjustment syndrome is a group of symptoms including the stressful events, namely the pandemic, hopelessness, meaninglessness, feeling sad and depressed. Along with this psychological symptoms, again there is aggravation of physical symptoms, which this COVID-19 has brought. Now, there have been number of researches that has been conducted, number of surveys that have been conducted, but for the presentation purpose and because of time limit, I will be mentioning only two. One online survey was being conducted in May on 159 individuals reported that there was an increase in the number of suicidal ideation. But this increase was thrice in number besides the virus-related suicide. There have been suicide due to virus. Those who have been found positive, or those who showed positive symptoms. But there was thrice in increase in the number of people, even among the normals. So this is again a big challenge for all of us to deal with. NIMHANS reported that the suicidal ideation was found more among the disadvantaged section of the society. That included women, the laborers, and a group of children. I'm not touching the statistical part. I will go with psychological and social impact. The pandemic has caused the psychological and social impact as mental health challenges. Among the psychological impact, I would say that the anxiety level has increased from moderate level to severe, which is again to be given a thought. We are physically restricted to home, not remaining much active. There is always a stigma and fear, irregular sleep patterns, because our routine has changed. The biological clock is not being maintained, or biological clock has changed. There is anxiety being dying. Death anxiety was being found among the elderly. Now this death anxiety is being again found among the youth. So there is constant anxiety as to I will catch some symptom and I will die. That was again being found among the youth. Less favorable diet, some of the things are not being available in the market. And there is aggravation of the previous health symptoms. Among the social impact, there are barriers again against the healthcare seeking. Mostly people thought that if I will sneeze and I have to approach a doctor, there was really a fear. Will I be diagnosed as positive? Whether the hospital facilities would be available? Have I to go so far for the hospital or to receive medical help? Social marginalization. Then distrust in health authorities. How could I trust a doctor? That was again a big question that arose in the mind of the people. Developing other symptoms of other disorders, job uncertainty, and again stress, that is work from home and doing again household work. This is again the stressful event of pandemic again brought stress to all of us. Emotional abuse. Children are mostly being bombarded by giving so many advices by the parents and again by the medias. Violence at home. Up till now, I was under impression that the violence is only with women. My friend is having an NGO in Indore, and before 2 days, she told me that violent cases or home violence was again equally being registered as males have become the victim of violence at home. One of the professor was being given only 10 rupees for the daily this thing, and he was so depressed that he wanted counseling, online counseling. And this was really like, for me, it is again a mental health challenge as to what is to be done. Let me come to my main topic, how to cope up with pandemic and how to prevent suicide. Since self-harm and suicide are very much subjective in nature, almost all people do not commit suicide, and all are not equally affected by this pandemic. So since both are subjective in nature, so the coping strategies or the coping measures are again being noted by me as to what is to be done at the individual level. What should I do to cope up with pandemic and to avoid the suicidal thoughts? The first one is looking after one's own mental health as to maintaining my thought pattern. How long do I think about pandemic? How long am I thinking about the same thought recurring over and over in my mind. So the thought patterns are to be noted down by me. So looking after one's own mental health is very important. Next is adapting new lifestyle. New lifestyle is the change for betterment, the change that is leading me to cope up with the life situations. The life situation, not merely pandemic, but it could be working from home. It could be anything. When some of the things are not being available in the market, I have to get adjusted as to what are the things that are available, I have to manage. So adapting new lifestyle, maintaining a fresh routine, maybe that whatever regularly you have been doing, the same routine could be maintained. Personal hygiene is to be taken care of, exercising regularly, and doing things that one enjoys. It could be anything, playing video games, watching movies, spending time on phone with the loved ones. Another measure, very important, is to minimize news feed. How much time one spends to watch the news. That is again very much important because this is really affecting our health, especially our mental health. Because something that rolls on in our mind is corona, corona, corona. Next is maintaining social contact, keeping in touch with people, neighbors, discussing topics that one likes with who has got the same interest, people whom you like, your family members. So talking on phone again is important social contact. And another important this thing is sharing emotions and your fears. Many students give me call, ma'am, today I am feeling nervous. I'm asking why. Ma'am, I don't know the reason. So this unknown fears is to be again affecting our mental health. Next is restricting the alcohol and substance abuse. I would also like to talk about the screen time. Screen time is how much time one spends on Android or watching TV. That should be under our control, not for hours together. So that is screen time. Very important in interpersonal relationship is playing video games and watching movies with the family members. If I am an adolescent, playing video games with my siblings. If I am parent, playing video games with my children. So that the mindset is being changed. You are diverting your attention from corona to something that is entertainment, that is funny for us, that is relaxing for us. Another important thing, as we call it as altruistic or pro-social behavior, that is helping others, offering our support and services to people who are in need for help, maybe our neighbors, maybe community as a whole. Do not discriminate. What is discrimination? Do not discriminate between people who have suffered from corona or those who are back home after the treatment. The psychological assistance in the form of mental rehabilitation services, counseling services are again being helpful. So far as other coping means are concerned, the role of NGOs, counseling centers, and community health centers are again constantly at work. The College of Nursing as I teach over there, all the professors over there, the faculty, had been on the online helpline centers. So this is again a great contribution that suicidal thoughts are being prevented among the people, especially among the youth. Next is the media, all the channels who give us cartoon films, children's storybooks, or some of the intellectual activities that are constantly on social apps. These are again helpful to divert our mind, to divert our attention from suicidal thoughts to something that we like, we love. The role of counselors. Counseling could be done at 3 levels to cope up with coronavirus for the general public. I'm not positive, but I should maintain my personal hygiene. Secondly is how to face when tested positive, how to cope up. So these counseling centers are again helpful to the patients who are being found to be positive. And finally, how to face life after being discharged. That is showing the techniques helping to get readjusted to the society after being found or after the treatment. Thank you so much for the listening.
Thank you. Thank you, ma'am. Thank you.
Thank you so much, ma'am. Uh, just when the caterpillar thought the world has over, it become a butterfly. The moment you're ready to quit is usually the moment right before a miracle happens. Thank you so much, ma'am, for your such a knowledgeable experience and your case histories in school and colleges that you shared with us. Thank you so much for giving us a wide range of perspective. Thank you. Is there any question? If you have any question or queries for Arifa ma'am, you can put it on the chat box and we will answer your questions after some time. If you have any questions. Thank you so much, ma'am. And there is a question for Bashir sir actually. Uh, hello, Bashir sir, can we have a question answer session with you?
I think that let all the speakers
Later.
complete the thing, then we'll
Yeah.
answer the questions.
Hello, sir.
Hello, we audible.
Okay,
So
okay, sir. We will
I
have.
was planning to say that let all the speakers continue with their talks, and at the end we'll answer the questions
Sure.
according to the speaker. Yeah.
All the participants, please pay attention. All your questions are noted and they will be resolved after the session. Thank you so much.
Okay.
Now, I would like to welcome our another guest of honor, Dr. Ishita Chatterjee, Associate Professor, Department of Applied Psychology, University of Calcutta, Kolkata, West Bengal. We welcome you to share your knowledge among us. Ishita ma'am, over to you.
So much, Nandini.
Ma'am, you are not audible.
Okay.
It's okay. Take your time.
Good evening and thank you, Nandini. Can you hear me?
Yeah,
Yes,
okay.
ma'am, you are audible.
Yeah,
Okay. So, first of all, I would like to wish the 74th Independence Day and also say that we and pray that we are independent from negativity, corona, suicide, depression, stigma. This is my prayer for this Independent Day. Now, first of all, I like to thank the organizing committee headed by Professor Khalid for giving me this opportunity. He has a great leadership skill. And of course, the Professor Basir and Madam has beautifully said about this depression and suicide and suicidal prevention. So first of all, I would start with the risk factors. So Nandini, can you show my first 3 PPTs?
Sure, ma'am. Your PPTs are on screen.
Okay. So
Yes, ma'am.
yeah, thank you. The risk factors of this year is deteriorating mental health, and the causes are like uncertainty, economic deterioration, fear of having COVID of self or close one, isolation, etc. This COVID has taken a toll over the mental health to a very strong personality like Mr. Amitabh Bachchan. He has also written that this isolation has been very much mental health tolling because it has negative effects. So that please show the next slide, Ishan. I cannot see my slides. Please show the next slide. Yeah. So takes a mental toll. This has been shown over here. And you can go to the next slide. Please go to the next slide. Yeah. So with this in background, I would like to share some of the causes of suicide and prevention. This is empirical and research based. The first finding is mine own, which I had conducted under a UGC project. The present study investigated intrinsic and extrinsic factors that could evoke suicidal ideation among female college students. Content analysis of interview of 120 female college students revealed broad factors leading to suicidal ideation, namely academic, interpersonal, and environmental related. Events like public embarrassment due to some freaky incident, harassment, rape, and being jilted in love were relatively more important, while events like death of a loved one and acute financial crisis were found relatively less significant for this sample. Further, the adult suicidal ideation questionnaire has been administered to them to assess the frequency of occurrence of suicidal thought. Within the past 1 month, results revealed that about 12.5% of the students had suicidal ideation. Reasons for leaving having been found to have negative but significant relation to suicidal thought. Concern for future and moral objections is found to be strongly and negatively related to the suicidal thought. This study reveals that strong and positive reason for living is useful in preventing suicide. Moreover, the findings are relevant for therapists and counselors in assessing suicidal risks. The rate of suicidal ideation everywhere continues to increase, and adolescents are therefore at the risks of displaying suicidal behavior. This study was examined the proactive role or the reason for living and coping in reducing suicidal ideations among young adolescents. Method was a cross-sectional survey was conducted among 76 adolescents aged between 13 and 19 years of age, with the majority being from different places of India and neighboring countries. The brief reason for leaving for adolescents, BRFLA, and the coping scale and suicidal ideation scale were employed. The results showed that reason for leaving and palliative coping strategies correlated negatively with suicidal ideation, although further analysis using multiple regression revealed that family alliance and optimistic and palliative coping strategies were found to be significant for reasons for living that protects adolescents from suicidal thought. Also, those adolescents who use emotive coping strategies had higher suicidal ideation than those who used problem-based coping strategies. Cultural and social values continue to play an important role in protecting adolescents from suicidal behavior. The last study leading to the cause of death among the age group 15 and 30 years, youth suicidal behavior has a continuously to be a significant national problem in need of urgent attention. Common risk factors of suicide behavior was examined in this study. A descriptive method was adopted and data was collected via 500 response in 5 tertiary educational institutions. Data analysis was performed using percentages, means, t-test, correlation, and regression analysis. Findings indicated that depression and mental illness, anxiety and stress, sexual violence, substance use, unemployment and poverty, and interpersonal conflicts were the most risk factors predicting suicide behavior in youths. Thus, the study recommends, among others, that greater emphasis should be placed on encouraging healthy peer relationship among youths and young adults. This is because of social cohesiveness and tolerance have been shown to improve the mental well-being of young people. Now, after the findings, let me say something about the prevention strategies. So, can you show the next PPTs? So, a strong positive reason for living is useful in suicide. Moral and spiritual, factors also influence, and if used properly can help in suicidal prevention. Next slide. Next PPT. Yeah, concern for future and moral objections is found to be strongly and negatively related to suicidal thoughts. Next. So next is another thing which I want to say is that avoid substances like tobacco and others, which even worsens the thing than alcohol, and other drugs should be avoided. Do not judge people with a COVID infection that you will also have. Try to take the precautions, but don't be carried away by or overwhelmed with this. Next slide. Enjoy nature, natural beauty, spend time with nature. Along with this, I would like to say mindfulness training is very important, because if you have used mindfulness, you will not be overwhelmed with your situations or around the bombardment of the information and others. So nowadays, many universities have started free courses on how to control your thought, how to control the thought processes, so that you are not overwhelmed with the negativity around you, and you try to reinforce the positive things rather than negative. Live with positive vibes. This is important. And here, along with I'll say the other techniques of meditation, yoga, pranayam, you can go for expressive art therapy. That is also very good. And things like painting or sculpturing or doing anything positive is very much helpful. So when you get time, don't think that you are being bored. You can look deep inside yourself and find that in your life, busy life, you had no time for this hobbies or inner self-cultivating things which you long to do. Please utilize the time effectively, efficiently, by cultivating your hobbies and other things, so that you can see the other dimensions of life. So along with this, I would please go for the next slide. I would say a very heartfelt thank you. And again, I end my talk with a very positive vibe. That is, we all look forward for a society soon that is without stigma, without corona, and we are back with the main life stream, and have a very positive and future ahead. Wishing you all a positive future ahead. Thank you. If you have any questions, you can write it directly, or after the session, I can answer them. Okay. Thank you.
Thank you, Professor.
Thank you so much, ma'am. Sometimes the best thing you can do is not thinking, not wondering, not imaging, not obsessing, and just breathe. Have faith, and everything will work out for the best. Thank you so much, ma'am, for giving us a wonderful session about how to manage such suicidal thoughts or negative thoughts in this COVID-19 pandemic. Thank you so much, ma'am. Next, I would like to welcome Ms. Ketki Sangvi, Program Manager, Sisters Living Work, an NGO dedicated to preventing suicide. Has 12 years of experience in the field of menstrual hygiene, child sexual abuse, protection and prevention of suicide. She is trained dance movement therapist, somatic healer, and a graphologist. I welcome you to share your knowledge in this webinar. Ketki ma'am, please. Hello, Ketki
Yes,
ma'am.
yes, yes. I am very much
Yes,
here.
ma'am.
Can you please give me rights to share my screen?
Sure, ma'am. You can share your
Yeah,
screen
okay,
anytime
okay.
you want.
Sure. Hello, everyone.
Hello.
Yes, I hope my screen is visible to all of you.
Yes.
Yes,
Great.
ma'am. Your screen is visible.
Great, great. Thank you so much. We are listening to this great speakers, and it has been really wonderful to hear their experiences. We are in small NGO working on suicide prevention, and we believe that awareness can save lives. Our NGO started 5 years back when our founder Gayatri, she lost her family members to suicide, and when she came back, she lives in US. When she came to India, she found that there is so much stigma around it, and that's when she founded this NGO to create awareness, to eliminate stigma, and to reduce the number of deaths by suicide. So basically what we do is we do a lot of awareness workshops in different, we have different set of modules for different people. For counselors, we have a different set of modules. For college and school students, we have different set of modules. Then we also have this Into the Light, which is virtual run coming up. And this is our annual event where we bring people together. This year, of course, bringing people together is not going to be possible. So we are organizing this virtually. So we are trying to gather people from around the world to join this run of ours, and where we want to spread awareness about suicide through this run. We also have support groups for people who have lost their loved ones to suicide. And we believe that there is no single cause of suicide. Suicide most often occurs when there are immediate stress events, as Dr. Bashir said. Uh, so what are the different causes to suicide? There are environmental causes, there are historical causes, there is social media influence, there is health, and there is currently for pandemic, there is social isolation. So environmental causes could include dysfunctional families, could include divorce or rape or anything which has to do with environment. So anything which triggers a person from their environment would come in the environmental causes. Historical causes would be, let me give me an example for historical cause. Say if my mother died by suicide because she was distressed, and when I am in distress, I also try to follow her footsteps. So this is like history of the person can also add to the risk to suicide. Social media, we know that there are so many games being played online, which gives very difficult task to young students. And one of the tasks being that you either slash yourself or jump from the train or run with the speed of train, and if you fail, then just jump off on the tracks. And there are health reasons. The persistent health problems could add to the risk to suicide. Social isolation, now we know, I'm not going into detail of social isolation because the other speakers have already spoken about social isolation. It is important to remember that all the people communicate their thoughts and intentions about suicide. They often send out signals like, I want to die, or I'm feeling useless. And all these ideas or pleas or words must not be ignored, because suicide is one of the most preventable forms of death. So what are the warning signs? Let's discuss it's as a friend, or as a mother, or as a person living in the community. These are simple things, simple warning signs which we would like to present. If there is anything, if you see a person who has these kind of warning signs, do not ignore those warning signs. So let us discuss what are the warning signs. Speech. Speech could be direct sentences. It could be, a sentence like, I want to kill myself, I am suicidal, I have a plan to kill myself, I wish I were dead, or I am the I'm so useless, the world doesn't need me anymore, my life is just unbearable and I don't want this to continue for long. Or people who have mental health illness is like schizophrenia, or who are hallucinating, constantly give this that I'm hearing voices telling me to kill myself. So these are some of the direct statements in any language. If you come across as a common person, if you come across any such statements, think about it and be very alert about the statements, because these are the signs. And if you relate to any suicide you have seen in the past, if you have, then you will find that there are some signs which were always given, but probably we ignored it because we didn't have awareness of that. Then there are indirect signs, indirect statements like, I am so tired of all this nonsense happening around me. I'm having so hard time to cope up with every little thing. I just want to disappear. There's this among youth. There is this popular statement, I want to be the star. I just want to go and hug the stars. Then will you miss me if I'm gone, or my life is hopeless and it's never going to get better. um, of lately, the lot of people have also started putting up stories on their Insta or on their Facebook about these kind of messages, indirect messages, which are warning signs. Then there are behavioral signs, isolating from family and friends. Uh, this isolation does not mean just the pandemic related isolation, but this is isolation in general pattern of their living. Increased use of alcohol and drugs, giving away treasured possessions. Now this is a very big behavioral sign. So person who is trying to give away the treasured possessions, trying to complete the affairs, is is uh, is a behavioral sign of suicidal thoughts. Then there is lack of motivation in self-care activities, writing poems or songs or letters about death and separation. And even the day-to-day normal activities become so burdensome, so heavy, that you cannot do. Even like getting up and brushing your teeth is a task for so many people who struggle with mental illness, or who can't cope up with the situation. Experience drastic changes in eating and sleeping patterns. In pandemic, I have heard and I have read so many articles that the entire cycle of youth population is reversed. They are staying away all night. They are sleeping entire day, and this impacts the mental health of a person. uh, uh, as somebody said in the earlier side, that losing desire, Bashir sir said this, losing desire to take part in your favorite activities is a big behavioral sign. And having trouble in concentrating or thinking clearly, or unexpected decline in performances. The performance could be not just academic, but even the performance for your home, the cooking, which is a simple task for people who do it every day. Even undecline in a unexpected decline in those kind of performances. Continuous feeling of depression or apathy or impulsivity, anxiety, rage or anger and irritability are the signs of suicidal thoughts. What do you do? So as a first responder, what will you do? What will you do if your brother, if you are a brother, or if you're a sister, and if you come across this signs in your family members? Three things: ask, care, and treat. So what do you ask? Ask the person, as sir said in the beginning, ask the person if the person is thinking about suicide. Actively listen to the person, what he or she has to say. One thing we generally, as not as mental health professionals, because but as commoners, we do is not listen to the person, and we just try and shut off. No, this doesn't happen, you are just hallucinating, or this is your dream. So just listen to that person, acknowledge the person's behavior, acknowledge the person's feelings. In pandemic, a lot of us are not acknowledging the people we are staying with. we are forgetting to appreciate them for little things. So as families, we need to start acknowledging each other, appreciating each other for what we have achieved so far. Don't debate whether suicide is right or wrong, or don't discuss the feelings are good or bad. The feelings could be different for each of us in the same situation, but so don't at all get into that entire discussion, this is wrong, or compare. I have seen a case where this uh, uh, the student, the mother, when the daughter started sharing her suicidal thoughts, the mother said, "Oh, but you can't be suicidal because your life is better than XYZ's life." And it's the girl broke down there, that you cannot be comparing the life of two individuals and lecture the person on value of life. The person has decided uh, to take this step because she can't bear the pain, she can't bear uh, the emotional distress she is going through. So let's not get into lecturing the person on value of life. Care. Let the person know that you care and you understand. So from your body language, from your words, you need to show more care towards the person. Discuss and care about what are the things which are bothering the person. Maintain very good eye contact and give undivided attention. And if she has a plan for suicide, so if she has a plan, discuss further that what is the plan, how is the person going to do this, and try and remove that lethal objects, lethal substances from that area. And listen without judging. This is the most difficult thing to do, but the most important thing to do. uh, don't encourage the person and act shocked. uh, I had this young mother who said that my 14-year-old always tells me he wants to die by suicide, but he doesn't do it. I've been telling him go and die, but he doesn't do it. So even for encouraging the, if the mother repeated this, the child might have uh, done and done this act. But don't encourage the person to do it, or act shocked. Act shocked when the person shares the plan, or when the person says, yes, I'm suicidal, I want to kill myself because I'm tired in life. Don't act shocked. Treat. Yes, as if you're not a mental health professional, find a mental health professional. And there are helplines, there are email counseling facilities available, there are OPDs, there are n number of things which are available. Try and get access to those things. Don't leave the person alone even for few minutes. If the person is in a very emotionally distressed, don't leave the person for even few minutes alone. The person might harm himself or herself. And be sworn to secrecy. A lot of us do that. A lot of youth, especially youngsters, this is my secret and this will be between the two of us. Don't get into that secrecy, or ye mera secret. Don't ever get into that, because we will need help from professional if we have to save that person's life. And even there are a lot of arguments even for a mental health professional who sign the confidentiality clause that we will not share about your problems to anybody. But even to them we would encourage that don't have a clause like that when it comes to a person's life. So, what to do when somebody is suicidal? Start by asking questions. As Bashir sir already said, that ask the question, are you suicidal? Ask the question, what is your plan? Ask the question, what is bothering you? Look out for those signs. Look out for those little signs which the person is conveying. um, get help from a trained professional. So if you find that there is something, there are some warning signs being displayed, but you are not confident enough to handle everything, find a trained professional, seek guidance from them, and try and refer that person as early as possible. Takes all these signs of suicidal behavior very, very seriously. So it's not that because a person is saying, the person will not do. The person will do if the person is saying. Offer support. What kind of support can you offer as a common person? So encourage the person to call some hotline numbers. I'm sure Nandini is going to share a few hotline numbers post the session. encourage the person to seek treatment, encourage the person to have help seeking behavior. One of the most difficult thing for us to do is to ask for help, and we need to encourage help seeking behavior. We need to try and break the stigma around mental health. We should try and have those dining table conversations which says that physical health is how you can go to a doctor for if you have a stomach ache. Similarly, if you are not able to cope up with things, if you are not able to handle your own emotions well, go and seek a mental health professional, and it's completely fine to do that. So let's start encouraging that behavior amongst each other. Encourage the person to communicate with you the thoughts and the feelings, and also give plenty of time to share those, because it's so difficult to share your feelings. The words might be really easy, but it's very difficult to come to that sharing. Be respectful and acknowledge the feelings of each other, as I said earlier. uh, Offer reassurances that things will be better, and try and give that message that suicide is a is not a permanent solution for temporary problem. Suicide cannot be a permanent solution. And as I said, remove dangerous items. It could be sharp objects, it could be any poison around, it could be little blades found in the house, or for a lot of women who consume phenyls or other the other uh, liquids which are found in the house. Try and remove the access to that from the house. uh, yes, we. If you want to understand more for the students, and if you want to have workshops like the long workshops, please feel free to write to us. We also have support groups online, where we provide support to people who have lost their loved ones to suicide, and we are trying to break that stigma. Uh, yes, Nandini, it's over to you. So if anybody has questions, please feel free to ask.
Thank you so much, ma'am. Before you can see the lights, you have to deal with the darkness. That's the main thing. Thank you so much for giving us such a great session about the symptomatology, which is not only useful for the mental health professionals, but for the caregivers, for the normal population, and everyone. Thank you so much, ma'am, to sharing those knowledgeable things with us. Now, last but not the least, I would like to welcome one of our invited speaker, Anjali Seth, School Counselor, Sunbeam Academy, Varuna, Varanasi, to talk about the suicide prevention and mental health issues. Anjali ma'am, over to you. Hello.
Good evening, everyone. My name is Anjali Seth and I work as a counseling psychologist. Today, I want to talk to you all about developing positive attitude. Okay, so just within few seconds, you can see my slide. Is it visible to everyone?
Yes, ma'am, it is visible. You can continue.
Okay, thank you so much, Nandini ma'am. So I'm going to talk about developing positive attitude toward life among students. Before I start my presentation, I would like to talk about my objective of today's session, that why I am discussing about positive attitude. About 8 lakhs people die by suicide worldwide every year. Research shows that approximately 90% of the people who are dying by suicide are basically suffering from mental illness, most commonly from depression. In the April issue of the Journal of Research of Personality, Mr. Ivan M. Clayman has conducted one study over around 209 students took participation in that study, and it was lasted for 4 weeks. And results found that greed and gratitude make a great team. They make life meaningful and reduce suicidal thoughts independent of depression symptoms. As we all know that people in the mental health care profession are less in proportion to the people who are in need. In that situation, if we want to meet the current demand of situation, what we are supposed to do is that we are supposed to find some alternative ways to help the people, apart from motivating the people who want to participate in like sorry, what I would like to say is that, as we all know, that if we really want to help the people, what we're supposed to do is we have to find two alternative ways. First way is to develop emotional literacy among people, and second is to help people or the children around us to develop certain skills which leads them to have a more you can say more better coping strategies. Because in researches it has been shown that people who were committing suicides were the ones who were using the coping strategies which were more negative, or you may say that they were practicing more irrational beliefs rather than people who were mentally healthy. So in that situation, I would like to talk about that it is always better to do prevention. And when I say prevention, if people are becoming sensitive towards each other, and if people are becoming more positive in their attitude, they will have less chances of doing the faulty coping strategies, and they will be able to perform, or they will be able to understand the reality in a more better way. So first, I'm going to talk about happiness. As a person, we all think that if I get this car, if I get this phone, if I get this particular object, I will get happiness. But whatever things we get, it only adds the utility value. It is not the reason of my happiness. Happiness is a state of mind. Happiness is a choice. So for example, if I'm talking about happiness, I'm going to tell you a joke. There are three kind of people in this world. First are the ones who knows that, okay, it's my fault, and they say sorry. They are the ones whom we call us as an honest person. Second people are the ones who think that, okay, I may be wrong, and they say sorry because they find it better to say sorry if they are having certain doubts. We call that those people as a wise person. And the third one is the ones who know that they are not doing any fault, they are completely right, but still they say sorry. They are the ones to whom we call as a husband. Basically what I'm trying to say is, I'm trying to tell you a joke. When we listen a joke for a first time, it becomes very easy for us to laugh, but when we listen the same joke again, it becomes so difficult for us to laugh on the same joke. When we cannot laugh on the same joke two times, why we laugh on the same problem again and again? If we are crying on the same problem in again, like if we are crying on the problem again and again, it always like suggested to have a more positive outlook toward life. Suppose if I have to unlock a lock, if I don't have a key, I have to find the key rather only looking on the lock. So happiness is a choice. Happiness is a state of mind. As we are working, like I work as a counselor, what I try to do is I try to like to do sessions on emotional literacy to get connected with the people, to become more aware about each other's emotion, and try to find the happiness, inner happiness, happiness which does not rely on any outside, you may say, stimulus. Second is comfort zone. We all want to achieve something in life. Like when we see in cases of suicide, people have very good ambitions. They want to be happy in their life. They want to do something very productive. But when it comes to living your life, I don't want to leave my comfort zone, but at the same time, I want to work. I want to get a different result. Life is like a science experiment. If I want to get a different result, I have to change my process. If I am doing the same process again and again, and I want a different result, then I will get disappointment. For getting a different result, I have to go out of comfort zone. I have to meet people. I have to think about that where I am doing wrong. Without leaving your comfort zone, you may not get what you want to get, yeah, or what you want to achieve in your life. So going out of your comfort zone for achieving what you want is a very sign of a confident personality. So I used to do is, like whenever I'm talking to people, I used to say that if you want to achieve something, you have to change the process. You have to leave your comfort zone, because life is not only about growing through. Life is not only about going through. Life is also about growing through. Now, in life, there is no failure. There is only feedback. We all have played this type of game in our childhood. We have an object, or we have a basic target, and we have a multiple ways. In this game, what we do is we go with a certain way. When we think that this, by opting this way, if I cannot meet my destination, I use the another way. In the same way life works. If you want to achieve something and your one way is not working, you don't have to change your destination, you don't have to change your ambition, you have to change your way. And when you are changing your way, you have to take feedback, positive or negative. Positive, so that, like, if you are doing something right, you have to repeat that so that you can achieve the same thing again. And if you are doing something wrong, you have to keep in mind that no, I don't have to do this because it is not working for me. Okay. In the same way, if you are meeting any person to whom you feel that they are feeling very worthless, they are feeling that I am not being very productive, in that situation, what they are supposed to do is they have to understand that I have to change my way, not my ambition. Next, live, learn, and laugh. Life is about living, learning, and laughing on the mistakes what we are doing, and learn to let go. Suppose, as you all are witnessing this presentation, if I hold your hand, okay, and I ask you, okay, I am holding your hand now. You can go out of this room. You may walk for 2, 3, 4 steps, and after that you will say, now I cannot go out of this room. So in the same way, our past is holding us. Yes, we have certain bad memories in my life, or our life, and as we all know that it in our flashbulb memory or in our emotional memory, most of the situation or memories are related to negative experience of life. So what I am supposed to do is I have to learn. That people are supposed to learn to let go, because we all are doing something good and something wrong. So we have to understand that if we will not let go, the burden on the shoulder will become so much, the burden will be so much that it will become very difficult for us to move ahead in our life. As Buddha said, that if you want to live peacefully in life, you have to focus on present. But when we focus on past, we get more depressive thoughts. When we focus on future, we get more anxious thoughts. So living in present, laughing on your mistakes, learning on your mistakes will make you to live a more productive life and develop more rational beliefs. Attitude toward change. As we talk about change, when certain things change in our life, we become very afraid. But we have to understand as a positive people that if something is changing in my environment, I have to be ready for the new experience. Everything cannot be same. As people say that this world is very selfish, people are people are trying to ditch me. They want to, they only come and talk to me when they are getting certain benefits, or they become very anxious when they have to face any change. But I would like to say, just imagine if I or you all or we all, if we don't ever face cheating, if we ever not fail betrayal, do you think that we all can become ever an intelligent person or a mature person? If everything in my life is going very positive and very fine, then there will be no difference between my life and a child life of a 6 years. So if I am facing a negative experience of if I'm facing a negative event in my life, that is only because I'm getting ready for my future challenges. And future challenges, I need this knowledge for this. Because of that, I am getting certain kind of exposure. So you have to have a positive attitude that if you want to learn something, you have to be ready for experience. And change are not negative. Change is a situation. We can either take it in a positive way or in a negative way. Next, your thoughts are not you. When I say that, when I think that I'm worthless, when I think that I am not making a big difference, when I'm thinking that people are not loving me, these are only my thoughts, that are only my opinion. It is not the fact. So your thoughts are not you. You can change your thoughts. If you think that this thought is not giving me any benefit to me, then I can change my thought. And I have to change my thought till the time I will not get a thought which is going to enhance my performance, or which is going to make me live a more better life. So you have to change your negative thoughts, and remember, your thoughts are not you. You can always choose your thoughts. So when we are talking to kids, when we are talking to people around us, and if they are having negative self-esteem, if they have negative self-image, you have to say that it is your opinion, it is not the fact. The fact may be vary from what you are experiencing. So try to change your thought. I know it is not very easy, but you have to do it, because you are misinterpreting your own image. You have to acknowledge, you have to make them understand that their thoughts are only thoughts. It is not the fact what they are assuming to be. Then decision shapes destiny. When it comes to decision making, there are two type of people. One are the ones who think about problem, take a pause, become calm, and after that take the decision on with a very peace of mind. Okay, and the second are the ones who take the decision only to calm their mind. So we have two type of people. First are the one who become calm and take decision, and second are the ones who become who take decision for becoming calm. For example, if I think that like giving phone to my kid is not good, I am trying to become calm, I am taking some time, and then I'm trying to make realize to my child so that this is not right for you. Okay, and the second person can be that if I feel very irritated because my child is nagging for phone, and I give that phone to me only so that I can get some peace of mind. So when you are taking decision, you have to understand, or people have to understand, that when you are taking long lasting decisions, when you are taking decisions related to your important decisions of life, you have to first have a peace of mind, calm down yourself. You have to take decision from your mind, not from your heart. Because when you are taking decision from your heart and emotions are waves of ocean, may you feel regret on the same decision after some time. But when you are thinking from your mind, you are applying logic, there is chances that you will take more correct decision. There is thin difference between what is good and what is right. Good is decided by heart and right is decided by mind. So when we are taking big challenges, or when I'm taking a far-sighted decision, what I'm supposed to do is I have to take decision with a calm state of mind. So whenever you are meeting people, or whenever we are discussing with people, just ask a simple question. Okay, you are taking this decision, you are just taking this decision to calm yourself, or you are taking this decision with a calm state of mind? Then you will understand, and they will immediately realize that no, there is something which I am doing wrong. And master key. Positive attitude is the master key. Yesterday, I had a conversation with a very famous psychiatrist, and when I asked that person that nowadays the rate of suicide prevention is becoming so high that I feel in future we have to face a more difficult situation. And what we can do? Then the person said, I think that we are supposed to help the kids to develop certain skills which will lead them to live a more confident life, and they are going to be prepared for the future challenges. And then I immediately realized that I have read one book which is written by the Martin Seligman, and the name of the book was Learn Optimism. So when we are meeting people, when we are doing social literacy, emotional literacy, when we are meeting you may say the adults who are feeling negative, try to help them in building the positive attitude towards life. We can do it with by awareness program, we can do it by doing certain activities or asking thought provoking questions, or we can inculcate positive attitude through you may say value based stories, activities, and certain games as well. What you need to understand is that ultimately we have to make realize to that person that there in life there is two sides, like coin have a two side. So if you have a negative aspect, you have a positive aspect too. But as you are like practicing the faulty coping strategy, it becomes very difficult to see the positive aspect. So try to help the kids to develop skills related to forgiveness, greed, gratitude, so that they can see the positive aspect of life as well. And at last, I will tell you a story, very small story. What happens is, like in a city, there was a two neighbors, and they decided to plant tree. They both take care of the plant. One is a very young person and another person is an old person. So the young person who is planting the tree, what the person do is he gives a proper water, proper composite elements, everything to the tree as more than what is required. And the person who was the old person, the retired person, was the one who was giving a limited amount of water composite to the tree. So as the time was passing, what people saw was that the person who was an adult, that tree was growing very nicely, flourishing very nicely, and it looks so beautiful. At the same time, the person who was a retired person taking care of, like giving a very limited amount of, you may say, elements to the plant, saw that the plant was completely okay, but not looking very good. But what happens is one day a very big storm came. Next morning, when they both came out, what they saw is the adult person who was taking too much care of the plant was completely out of the ground. Like it was completely, you may say, ruined. It was completely ruined. But the retired person plant was completely still there. So the adult person asked to the retired person that my plant was looking so beautiful, my plant was flourishing so nice in comparison to yours. Then why my plant was damaged and yours is safe? Then the retired person says that, do you know, when you are giving too much, you may say, support to the plant, the plant was growing from outside, but the roots were very weak. But when I was giving very limited substance to the plant, it was trying to work, the plant was trying to work so hard to get the basic elements from the earth that the root was becoming more and more strong. So your plant was growing from outward and my plant was growing from inward. And that is the reason my plant survived. Why I'm telling you this story is that now what we are doing is we are doing so much for our kids. We are giving them what is even not required. So they are becoming very successful. They are doing very best in their life. But whenever they are facing any storm, they are not able to face the storm or meet the life challenges because inside of their personality, they don't have a very strong root. When I'm saying that I want my child to learn very nicely or become very successful, I have to understand that being successful is a different thing and being strong is a different thing. I have to build character. I have to make my kids or the people around me strong so that they are ready to face future challenges. And this is my name. I am Anjali Seth. This is my contact number. I used to take sessions for kids and the peace psychology professionals, and that how to motivate people, how to develop counseling skills, and how to, you may say, that learn the important, you may say, the important thing, which like techniques which are applied in counseling. If anyone have any question, you can ask your question. And thank you so much.
Thank you so much, ma'am. When things are tough, you must be tougher. Show them that your life can be better. Thank you, ma'am, for giving us such a wonderful session regarding how to manage the suicidal thoughts in the population. Thank you so much. And one more thing, if anybody has any queries, they can ask their questions in the chat box so we can indicate those speakers and resolve your queries. Bashir sir, we have a query for you. Hello, Bashir sir. Are you there? Dr. Basir? Bashir sir, are you there?
Yeah, I'm here. Hello?
Yes, sir.
Am I audible?
Yes, sir, you are audible.
Yeah. Can you repeat the question, please?
Yeah, sure, sir. Rajat Datta, he asked you that how can we find a mental disorder person?
Oh, come on. I think that's a basic question. Like, I should say that as every mental health professional, they has been trained that mentally disordered person is not to be found. Actually, I should say when it comes to a definition for mental health disorder, we follow two types of definitions. One is, you see, when we also first of all define normality, and when we find that some particular mental faculties, mental cognition, they go beyond that normality, and then we say that it is so. Like anxiety, it is a very common mental cognition. So, but same anxiety, when it is something affecting your life, then it is a disorder. And similarly, other things also. And second thing, that sometimes also when in the same normality, we see that the person's faculty, the person's ability is coming down. Like somebody, let us say, we do a mental intelligence test, and we find that person's ability is below the normal. So we call it a learning disorder or something like that. So there are the basic type of methods we use to diagnose mental disorder is that number one, thorough interview, which includes the mental status examination, and many a times we do some very particular types of examination which are called a battery of a mental test. Okay. The second question, please.
Second
I think
question
there is
was
another.
from Sandeep Bhaskar Deore, which is basic biological effect in depression and suicidal ideation.
You see, depression has been long been studied biologically to find out the cause. There are many theories. One very common theory is all of you must be aware of, anyone related with mental health, is that the neuroamine, monoamine theory. In the brain, there is a very important neurotransmitter. Our brain has been containing more than 2,000 chemicals. Out of them, there is a monoamine, and out of that monoamine, there is one called serotonin. And there has been seen that serotonin has been found less in the brain, those who are suffering from depression. But apart from that, there are other many biological findings. One of very important biological finding I can say is there is decrease of the volume of hippocampus. And then again, when the studies has further seen that there is something called, there is a problem of drying up of the neural cells. And of course, if I go on, there is on and on. Even when they had done an autopsy of the brain, of dead brain, there is a shrinkage of some particular anatomical space in the brain. One of very important area is the prefrontal lobe. And I think there was another question. I think I have read it. It is that again, the what is the connection between substance abuse and let
Yes,
us say
sir.
suicide and depression? You see,
Mm-hmm.
the substances. If we ask about, let us say there are so many substances, but one thing is very true that all these substances they are working in the brain, and in fact, by definition, they can be called poisons for the brain. And what they do actually, let us take example the commonest, the biggest one culprit is the alcohol. Alcohol usually they try to do, our cells, they have a cell wall, and our cell wall is like we stay in a home and we had walls to protect us, and we have a gate. We want to allow someone and disallow someone, and exactly what they do, they actually do this permeability of the cell. And plus, of course, again, the alcohol also directly affect gamma aminobutyric acid is another neuroamine, and also there has been shown that it affects dopamine also. And in fact, some of these effects, they are desirable. But on long term, alcohol, it is destroying our brain or our nerve cells. So that's it.
Okay. Sir, one more question is from Gayatri
Yes.
Datta.
Yes.
She is asking, is there any possibility to career for suicidal tendency, to make them aware about suicidal tendency?
One, repeat it, please. Rephrase
Is
it.
there any possibility to make them aware about suicidal tendency?
The persons who are having this suicidal tendency.
Yes, sir.
No. You see, it is very, very simple. And I think you have told in the very beginning.
Sorry,
that those who are,
sir. Sorry,
Yeah.
sir. Is there any possibility to screen for suicidal tendency?
Of course. To be very frank, as I've just told you in the very beginning, that if you look at the persons, there are, you see, of course, if you look into the suicide, I've just told you that just look at that particular research where it is among the 15 years to 35 years. If I look at the number of deaths, it is in that young ones. So the number one cause of death is road traffic accident. But the second is suicide. Out of these suicides again, the more than 50% are with depression. So number one, if somebody, if the people I do just screen for depression, and severity of depression, and there is a scale for to see the severity of suicidality, and that's the screening. And of course, I have just tried to emphasize in today's talk that each one of us mental health experts, we should be very much aware about evaluation about the suicide. We should throw out that notion that asking people about suicide will make people more vulnerable to suicide. No, it is just the opposite. Lot of research has shown that you should actively ask about suicide, especially about suicidal thoughts. And not only just ask about the suicidal thought, but also you should evaluate about the frequency, about its severity, and about that behind that, the planning and the social situation and everything, so that we can really do something in the situation. That's it. Hello? Hello, Nandini. I think I have answered the question.
Hello.
Hello?
Hello.
Hello.
Yes, we can hear. Hello.
Nandini ma'am, kindly unmute yourself.
Hello.
Nandini, I think you have to
Hello.
unmute yourself.
Hello. Is this Gayatri ma'am?
Yes, yes.
Gayatri ma'am is, I would like to request Gayatri ma'am. She was asking so many questions. So please ma'am, you can ask over here on the meeting. And please indicate from which speaker you want your answer.
Okay, I was asking Dr. Bashir. Gayatri, hi, Dr. Khalid. This is Gayatri Datta from Sisters Living Works. I'm the founder. Ketki just spoke. And I just wanted to ask one question, which was, can you do a brain screening for early detection of suicidal behavior? Because I hear a lot, but I don't know how true that is.
No, actually, let me say we are progressing towards that. That recently, at least I should name two very particular investigations. One is the magnetic resonance imaging and the positron emission tomography. And out of that, already we had started recognizing there is a particular biological and physiological changes in the particular specific areas of the brain. And very near future, that can be predictive. The only thing, let me tell you about these two tests, making them as a screening thing, they are really still expensive. You know, a brain scan with contrast by this magnetic resonance imaging, that is nearly costing nearly around 10,000. And PET scan is much 5 times more than that. And that again, it is not only available easily. Until now, I should not say that for finding out suicidal behavior, we have any biological screening test, not at all, not yet available.
Okay, yeah, because there was a question about that from some other psychiatrist once. And apparently I heard, I think it was Dr. Shetty, that perhaps there's a very soon they're going to be able to do that. And I was curious if there is any breakthrough happening. But, you know, wonderful, doctor, you know, thank you so much. Your talk was wonderful, as with everyone else's. And I'll definitely connect with you later. And Dr. Khalid, thank you so much for inviting us. And I shall connect with all of you. Thank you. Everyone's talk was very informative. Thank you so much.
Okay, thank you, ma'am, for your connecting from long USA. So we are very much glad and that you could share, we could each other share the knowledge and others. Thank you, ma'am. Next, we will be, of course, connecting you also in all the webinars. Thank you, ma'am. Thank you, ma'am.
Thank you so much.
Thank you. Thank you so much, Gayatri, ma'am.
Thank you, Nandini.
We are glad that you are here. And one more question is for Anjali, ma'am, from Sandeep Deore. Is that how to convert, how to develop positive attitude?
Okay, so the question is how to develop positive attitude. Just imagine that if you want to plant a mango tree, you have to place the seed of a mango tree only. Okay, if you will place a seed of a mango tree and you want a tree of pomegranates to come out, it is not easy. So when you have to understand that how to develop positive attitude, what you have to do is you have to just invest some time in the activities which have a positive effect on you. For example, reading something positive, listening to something positive, or you can say watching to something positive will give a space in your mind to some kind of positive, you may say, thoughts. Okay. And when you say that you want to learn positive attitude, what we are supposed to understand is that in our mind, we have a lot amount of negative information. If my mind is completely full with the suppressed emotion, it becomes very hard for me to create some space for positive energy. In that situation, what I have to do is I have to first take out the suppressed emotion from my mind. For that, what I can do, I can do anything which gives me a feeling of spontaneity, like singing, dancing, reading. If you think that it is not working, or I don't know that what gives me spontaneity, we all know how to write. Just write whatever comes in your mind. Write, like, if you are getting a thought that what to write, just write that thought as well. Write whatever comes in your mind for 10 to 15 minutes, and after you think that no, now I don't have anything to write, you don't have to judge your feeling that it is positive or negative. You have to just whatever comes in your mind, and after 10 to 15 minutes, just just tear the page. You don't have to read the content what you was writing. Just tear the page and throw it in the dustbin. You will feel light. And just after that, try to listen something positive. What you are doing is you are trying to take out the negative information so that you can create some space for positive attitude. So express that negative, you can say suppressed emotion, and after, basically we call it as a catharsis. You can say in counseling it is called as a process of catharsis. So you have to do a catharsis, which can be through movement, drawing, writing, music, anything. And after that, create some space for positive attitude, and then listen something positive, read something positive, watch something positive, or try to think about certain rational beliefs. When I say rational beliefs, on Google you can find 13 rational beliefs of REBT. Just try to find out that what is the one irrational belief which is disturbing you. Like the first irrational belief is that we cannot be loved by everyone. What we want is that everybody should love us. So in that situation, you have to find out that which irrational belief is disturbing your coping skill, and after that, how to change that irrational belief into rational belief. There is a complete list which you will found, and try to just counter your irrational belief every time. If I say I'm worthless, if I say I'm unlucky, okay, so I have never did something which created meaning in somebody else's life. You have to challenge your own thoughts, and after the catharsis process, you will be able to receive positive information in a more better way. For developing positive attitude in the morning, when we get up early, half an hour is very important. Whatever I think in the beginning of the day, it creates a lasting impact on my mind. So when you get up early in the morning, create some space where you can do, you can say, invest your energy in doing something positive. You can do gardening, you can do meditation, walk, anything which makes you feel better. And at the same time, when you are starting your day, it is always suggested to have a goal set for your day. If you don't have any goal, you just go according to your mood and basically according to your emotion. But if you have a set goal that I have to eat on this time, I have to do this, you are basically working on the basis of logic. So when you have a set goal, your day is more productive and you feel less emotionally, you may say, disturbed. So have a positive attitude. For that, you have to do a bit of catharsis. At the same time, invest your time in positive activities. Give half an hour of early morning in doing something productive, which makes you feel better. And at the same time, have a goal set it so that you can set your goal that what I have to do today, so that you have less emotional responses in whole day. I hope
Thank you so much. Thank you so much, ma'am. And one more question is from Sandeep Bhaskar Deore, sir, that if suicidal thought is a disorder, Dr. Bashir, please can you answer that question as per your psychiatric point of view? It will be great if you can in light that matter?
No, suicidal thoughts can be taken as a symptom, mental symptom. And as such, if we look into sometimes the thoughts like this, it is again very common. Many situations people can have a fleeting thought of that both ho gaya. The problem here we are talking about is a serious suicidal thought, which is not only very powerful, very intruding, very much preoccupying, which is already making the person to get into a plan and then execute. So got my point. Like somebody like having an just a feeling like fever may not be diagnosed to taken as a treatment, but we have to evaluate that what type of fever it is. So exactly that way, suicidal thoughts is a symptom. And but what we are talking today, we are indulged into that suicidal thought is the serious suicidal thoughts which can lead to an successful attempt and loss of a life. So we should not say suicidal is a disorder. Rather, it is a symptom, and it is found in many mental. Most of the mental disorders, there is a risk of suicidal compared to general population. And general population can also they can commit suicide without any mental disorder. Even that can happen.
Thank you so much, sir. I hope that this helps you a lot, and I think we resolve your queries also. So sometimes people who commit suicide are not fully aware or in such a dark place that they don't consider that taking their own life will create a huge amount of pain, not for them only, but for the loved ones which are left behind. This act leaves people behind with unanswered questions, feelings of confusion and shame, as well as guilt around being able to prevent the suicide. One more question I think arises from Pankaj sir. That is and I think it is for Bashir sir only. What are
Yeah,
the
I have read that.
neurochemicals?
I have read
What are,
that. So let
yes,
me
sir.
let me repeat the question. I think
Sure.
exactly similar question has been answered. You
Mhm.
see, as I have told you that depressive disorder, the commonest and the most serious disorder, where one of the sequelae is suicide. And if we look into that, there is a huge research on biology, and in that biology, monoamine theory is the most common, where serotonin, dopamine, and noradrenaline are found responsible. Apart from that, there are other chemicals like aspartate and glutamate, and of course, newer theories are coming out, and especially the neurobiology, neuroplasticity theory of the brain, where you are finding them in the depressive disorder people.
Thank you so much, sir. So here we are talking about how to prevent suicidal thoughts or how to prevent suicide and what are the mental health issues that nowadays people feel during this pandemic. So it is very necessary to act upon that, to think over that. So stop, take a moment to reach out to those people who need your help. Give closure to your loved ones who are going through dark phases. As a psychologist or a counselor, I would recommend anyone, either it is known to you or you, take a moment to realize that when the mind is so dark, it can be hard to see any possibilities for the future happiness. But it can and often does get better. So, as a counselor, I would like to say, recommend them to consult doctor or mental health professional and to take the help of medication, counseling, exercise, eating well. Always balance your diet, getting into routine, have a good night's sleep. These small steps will help you to acquire your path. Give them a space to open up about themselves and talk comfortably. Let's talk together. Always remember, it is possible to recover from feelings of depression, pain, and suicidal thoughts. Thank you all for participating and listening to us patiently. I would like to thank our all guest of honor, especially Dr. Khalid sir, as he has given us opportunity to speak about this very important topic, that is suicide prevention in this platform and during this pandemic. I would like to convey my thanks to all the guests of honors, Dr. Bashir, Ms. Ketki, Dr. Ishita, and Dr. Arifa ma'am and Anjali Seth ma'am for giving us such an insightful knowledge. And we are very thankful for all the participants to giving us your valuable time. And an important announcement for all the participants. Please, please, please fill up your feedback form correctly, which will be provided to you within 1 hour of seminar to your respective email. This will help us to do your certification. This webinar is live on YouTube. The link was already given to you, and you can subscribe our channel for more updates on upcoming webinar organized by Professional Institute of Business. Here, I am ending this meeting. Hope we will meet soon, and I wish for your better future. Thank you, and you may leave the meeting. Thank you so much.
Thank you, everybody. Thanks to Nandini. Okay, thank you very much.